Good morning, everybody. It's time for our October forum video. So I'm excited. We have a lot of stuff to share. We had great forums yesterday, so I want to thank everybody who came. Phenomenal questions. It's been so exciting for me, to be honest with you, and the rest of the executive team, because the questions have been from all of y'all that have been very strategic about the organization's health and growth, and that is very unusual. So y'all should be very proud of yourself because of the way that we are coming together as a collective team. It is so impressive. So today topics we're going to talk about, back to profitability. We're going to give you a little update on the floods. We're almost at the other side of that big hill we had to climb, and we're almost done with it. We'll talk about a few KPIs just to keep you on the kind of 3 or 4 that we're really looking at to help drive for this year, our focus for 25. Community update, our successes, and then also I'll give you some updates on some of our physician recruitment as well. So back to profitability. So if you remember, we've kind of talked about, as we think about healthcare or an organization, and we think about a credit rating, just exactly like our personal credit, right? So as we pay our bills, as we manage our credit card debt, right, and we have a lot more available credit than we have it being charged, right? All those things are positive things, and they drive your credit score up. Well, remember, one of the big indicators for a hospital, meaning that they are healthy and they're stable, is days cash on hand. And so if everybody remembers, that first kind of threshold for us was to be above 100 days. Well, we're kind of bouncing between 97 and 99. So I feel really confident that by November we will be consistently above 100. So that is a humongous milestone for us. It's something to be excited about and celebrate. When we think about us having a good credit standing, right, that's not just for us to get a loan, but it's really us for just to do business with other vendors. They look at that to say, hey, are we a good risk? Are we going to continue to pay our bills, et cetera? And so that from a business standpoint and for our long-term viability, that is really important for us. When we look at the savings for overtime so far, we had about $250,000 in savings. Remember, what we're trying to kind of capture to match revenue with expenses is we had about a $500,000 a month bogey that we were trying to capture. And so, 250,000 is of the overtime savings is chipping away at that, right? We had our best month in supply savings. So we had $90,000 savings in supplies. We had a little bit of a kiss because the ORs were down, but the teams are doing a really good job. As we reopen the ORs, that team is working with supply chain. So Mariah and Jerry are working together, their 2 teams, in order for us to get a much better PAR system so that we actually can rotate our inventory, be a lot more efficient with that. If everybody remembers, when we looked at the calculation for what we lost in expired supplies in 24 was about $500,000, right? We want to make sure that that is significantly lower, as we finish this year. And so that's one of the reasons why we're putting all this effort in these processes going forward. So I'll give you the flood update. So we did technically open the OR on the 22nd of September. It didn't fully open, and the reason why that was because we had some issues with our HVAC, and mainly in our sterile supply area. So where that large area is, if everybody remembers, we had the flood on Friday. Then on Saturday, our HVAC went down. It was down for an extended period of time, and all of our sterile supplies have certain temperature thresholds that they have to be maintained. If they go outside of that range and they stay for a certain period of time, what ends up happening is we cannot guarantee the sterility of that. So we had to throw all those supplies away. It was about $200,000. So we've been super cautious to not use that room. We're going to get some extra AC and heating controls, and it's more on the cooling side than it is the heating side, in order for us to be able to make double sure that we can start utilizing that room, we can maintain that temperature consistently. So right now we've kind of got 2 of the ORs, we have 3. We have one OR that we're using every day. We have an OR that we're using for our sterile supplies until we can make sure that we can fully use the OR. The ORs look beautiful. The pre and post looks beautiful. We're actually going to get some new counters in the pre and post area because those are pretty old. So really that whole space has brand new monitors, brand new flooring, brand new paint, we'll have brand new counters. So it really looks beautiful, and it's going to be nice and functional for the team. The other areas that we had on the second flood was, remember, third, second, and first. Third and second are completely done, and they are all back in service. Everything is going super well with that. We had a little bit longer time frame for us to get the first floor, which was really the radiology department. We would have been able to do it a little bit faster, but that team was very smart about their looking at, hey, do we have everything flowing exactly the right way? And so the answer to that was no. And so since we're doing it, we're already kind of having to repair things. We kind of actually have changed the flow of the radiology department. And that, if you look down in our main lobby area, you see where the new entrance into radiology is. It's beautiful at the end of the lobby, and super exciting for us to have improved it. We're going to have improved signs, and it's going to make a lot more sense for our patients that actually come in to get service from us. Our flow before probably wasn't intuitive, wasn't probably as easy for somebody that's brand new, never had been in here, to make sense on where they needed to go. The second thing that the team did that was very smart, as we, and this happens nationally anyhow, we've had, some deaths related to MRI safety. And so what is coming down the pike from radiation safety is going to be that the MRI suite is going to have to be locked. So we took advantage of that. We were already messing with the area. So we now are going to have the ability to have that MRI suite secured. And so that will be secure for better safety for our staff, but also better safety for any of our patients, right? That we do not want to get harmed in that space. So super exciting about all the remodeling. We're probably about a week away roughly from radiology being fully opened. And then the next thing you will see is all the carpet that's in the main lobby. All that stuff is coming up, and we'll have nice new flooring. So the whole front, of the lobby entrance is going to be kind of revitalized or rejuvenated. So I'm really excited to see that and be able to, for us all to be proud, right, of the first impressions that are happening when people walk into our organization. So KPIs. So a couple of things that we've been talking about every month is, our swing bed. And so as we think about, our goal for us is to have 4 patients per day in our swing beds. And we're running 1 on average. Not surprising, because when we think about, we've been shut down from an OR perspective for 8 weeks. There is a percentage of patients that, we saw our admissions go down. Obviously, we would have them go down from a surgical perspective, but we also saw the actual volume in the ED go down as well. And a lot of that is because if somebody is going to come in, right, they have something that they're not feeling good, or they feel like it's some kind of acute issue they want to get looked at. If in the back of their head they think, what if this is surgical, they're probably not going to choose to come here when our ORs are down. So the exciting thing is all that stuff is back up, right? And so we are really, the next 60 days, Rhonda and them, from a marketing perspective, working with our leaders, we're going to be pushing lots of messages out related to us being fully open, the benefits of all the remodeling, and also really going to be talking about our new ED group, which started on the 23rd of September. So super excited about them partnering with us and how we're going to be able to really make a big impact in improving our flow within the emergency department. And so both of those things are just, great news as we look at how we actually can continue to care for the patients within our community. The second one is on the clinic side. And so when we started looking at this, probably about 6 or 7 months ago, what we saw was, we have the staff, we have the physicians, we have all these appointments, and we weren't filling all of them up. And so we had to look at that internally as, how do we make this better? We have the demand. We have people needing to get appointments, and we were not being able to get our arms around that fully to be able to get all those appointment slots filled. We have made so much progress in that space. Our average right now is about 87% of all our slots are filled, and actually people come. We used to be in the 60s. So over just a few months, we have really made a big impact in that. And again, why is that important? One, we've got demand and need in our community, and we need to meet that as quick as we can. The financial side to that is, right, it's revenue for us. As we deliver that care, we're going to be able to get reimbursed for that. So super exciting in that standpoint. The ER, I did kind of pull this out because when we think about our front door of the hospital, and that is a big front door for us, one of the two big indicators is our door to triage and door to provider. Both of those are big indicators for us to make sure that we can assess patients as they come into our emergency waiting room, and that we can prioritize their care. What has been known as, when we think about left without being seen or left without being treated, both of those are driven by efficiency or lack thereof. And so if you're not timely in both of those indicators, you tend to have a higher level of individuals that decide to leave without being treated or without being seen, and they leave to go find treatment somewhere else. We don't want that to happen. And so where we want to get that number, it needs to be less than 0.5%. What we used to think, actually not too many years ago, nationally, wasn't necessarily Rehoboth, but nationally, we used to think, oh, those are the patients that are low acuity and don't really need care. What we found out when we started looking at that nationally and actually measuring those things, that was actually very far from the truth. People that are really sick tend to not wait because they have a hard time. They're so uncomfortable. They feel so bad for having long actually waiting times in the ED, and they tend to leave. And so we want to really get that super, super important for us, right? Those patients that need admission or need treatment, we want to get every single one of them in our emergency room and get to wherever they need to go from the next level of care. So exciting for us because it's two big indicators. Our new ED group is really partnering with us for us to make sure that we really get as fast as we can get to that 0.5% on those indicators. So community update. So, one of the things that I'm wanting to do is, and any of us here, is really any time that we can get somebody to listen to us saying our needs as an organization and as a community, I'm going to take that advantage. So Think New Mexico actually interviewed me, and one of the things that I agreed to it was because it was about really how are we going to try to tackle the Medicaid, coverage and some of the new challenges related to the regulations from a federal standpoint. But the bigger issue, because it's, I think, the most acute and urgent, is the malpractice issue. We've got to get our legislators, we've got to get our community members, we've got to continue to push and say this, because when we think about New Mexico and the amount of malpractice that happens here and what's been charged and the judgments, they're exceedingly high. And it is driving physicians away to not want to come here, or the ones that are here to leave. And we've lost 4 within our community in this last year. And it is also driving, we have only one insurance company that's willing to do policies for malpractice. And so that's not great, right? For us, we need to have some of that fixed. One of the core issues is we need a cap on punitive damages. And so we're going to continue to promote that and verbalize that so we can hopefully get the right people, right, focused on the right things, so we actually can get this tackled and we can get some relief from that perspective. Mark DePauli is one of the mayor candidates, so I ended up, having some good discussion. I'm going to meet with the other 2 candidates, right? Anytime we can kind of talk about, how we want to work with the county, how we want to work with the city for us to partner with taking better care of our community, we need to partner with that. I met with the retired educators of McKinley County. It was absolutely just a fabulous group of people. And one of the things in that group really is for us to talk about our story, right? We are doing a lot of stuff. There's a lot of things changing and happening. The building's improving. We, are, starting to build and add new service lines. And so as those things continue to improve, right, we got to get that stuff out into the community so they know that there is more care that can actually be received here at RMCHCS, and they don't have to go out of their community to get care. And so we're going to continue to build on that. Also, we got McKinley Gallup Day, it's going to be at the state capitol. That'll happen in February. So that's kind of exciting. It's really a great time for, all the leaders in our community to be able to, to talk with the governors and some of the legislators about some of the needs in McKinley County and how they can partner with us for us to continue to drive better care here. Successes to date, our supply cost, we talked about the $90,000 that we saved. Well, what that equates to, when we look at a cost per patient per adjusted day, we were running about $1,304. Now our new low is $821. We want to get to $700 as kind of our goal, but we are fastly approaching that. And so that is super exciting. When we look at our ability to get our bills coded and get them ready for the final bill so we actually can submit them to the payers, we have hit that goal 3 months in a row. And so all that helps us from a timeliness standpoint of us getting, if we don't get it to the payer, we're not going to get paid for it. And so when we look at kind of that beginning or that pre-work before we send the bill out, there's a lot of great effort and movement in that space. Lab turnaround times. So we think about efficiency in the ED, lab results are a big deal, right? The lab has hit their goals in 3 months in a row, which is super exciting. And then of course I talked again about the between 97 and 99 days cash on hand. So I'll probably talk about that a lot because it's very exciting. When we look at improvements, so, on our KPIs, one of the things on our denials, because we track that and we kind of track our top three, we've had some changes in that. And so one of the things that have kind of popped up has been documentation. And what that means from, a provider standpoint is we have a working diagnosis. We say, hey, this is what we're going to treat. And sometimes that does change and evolve as we get tests, right? That's normal. But the documentation has to follow that. And if there's a mismatch between what we end up having as final diagnosis that don't match kind of treatments and don't match what we said to the insurance company that we were actually getting pre-approved and not good reasons for that, they can clearly follow that, it'll equate to denials. The charge lag for us to get our charges in, we're actually bringing that down. So we were at about 14.7. Overall turnover for staff, we're at 21%. National average is about 31. So we're good, but our goal is 18%. And every year we're going to probably crank that down a little bit longer. We want to have longevity. We want to hire the right people, have them in the right roles, give them the right education, and give them the right tools to be successful. And so all that plays into that retention and turnover. Our first case on time starts, big shout out to the OR team and the surgeons. We were at 61% last month. We're at 83% this month. So that is super, super exciting. That's a big deal for us. We want to make sure our OR is efficient. As we continue to grow volume, bring new surgeons in, have new service lines, right? Where if we start the day late and we have physicians following each other and they don't get the times that they were promised, right? Because we started late, that is not efficient, right? We have to make sure that as we plan a schedule that we're trying to adhere to that schedule and that we want to make sure that's as smooth as possible. Physician recruitment. So, we talked about having our full-time cardiologists, and we've got Dr. Shaw, who is one of the cardiologists that's going to be coming on site. He's going to be coming on site 10/20. And so we're excited about that. We also have Dr. Satar that is going to be telecardiology. We're going to have a blend of both of those. Telecardiology will probably stop after we get 2 full physicians that are going to be here full time. but in the meantime, we'll have to supplement that. We have Dr. Jandari, who is a pediatrician, and he's coming towards the end of October. And so we're excited. We've been recruiting for another peds for quite a long time, and I think he would be a great fit for our organization. Also, some people probably remember Samantha, who used to be a PA that worked with the general surgeons. She went to Phoenix. She's coming back, so we're thrilled to have her back. The general surgeons are thrilled to have her back. She does dermatology. There's just it's a big benefit to have her back partnering and working with us. And then we've got a couple of interviews for some behavioral health nurse practitioners because we have a hole in that space. And so that recruitment has gone really, really well. And so I'm very excited that we're making some great progress in there as well. So I hope this was informative. Thank you for all the hard work that you do every single day to continue to move the organization forward. So thank you very much and have a good day.